Hey everyone, and welcome. Today we're going to piece together a really fascinating medical puzzle. We're going to use just one single question to unlock the entire complex world of a very misunderstood public health issue, Hansen's disease, which you probably know better as leprosy. So I want you to think of this as more than just a quiz. We're detectives, and this is a case we have to solve together. Every option you're about to see is a clue, and by finding the one that's true, we're going to uncover some really critical facts about how we combat this ancient disease today. Okay, let's dive right in. Here it is, our central mystery. Only one of these statements is actually correct. So to get to the truth, we're going to have to go through them one by one, like real investigators, and see exactly where the evidence points us. You know, any good investigation has to start by weeding out the red herrings, right? So let's start by looking at the clues that are basically designed to throw us off the scent, beginning with our very first one, option A. So this first clue, it tries to connect two things, a really painful inflammatory reaction called erythema nodosum, with the results of a specific immune test, the Mitsuda test. On the surface, that sounds like it could be right, but is it really? Let's take a closer look. What you're seeing here is basically the two extremes of how the body can react to leprosy. It's a whole spectrum. Now, that painful reaction, the erythema nodosum, it only happens in patients at one specific end of that spectrum, the Virchowian pole. And what's happening there? Well, the body's cell-based defenses are super weak. The Mitsuda test is designed to measure exactly how strong those defenses are. So since they're weak, the test is always negative. So clue number one, totally busted. All right, let's check out our next lead. This one suggests that there's a single one-size-fits-all solution, the drug prednisone, for both major types of inflammatory reactions in Hansen's disease. I mean, could it really be that simple? And here's the deal. The treatment is actually highly specific. As you can see, prednisone is definitely the drug of choice for a type 1 reaction, no doubt. But for type 2, that's the erythema nodosum we just talked about, the go-to drug is actually thalidomide. So the idea of a single treatment for both is just wrong. This clue is another dead end. Now for our final false lead. This one throws a really complex situation at us. What if a patient has both Hansen's disease and tuberculosis, which, by the way, is caused by a bacterial cousin? The clue suggests you can just, stick to the standard leprosy treatment. And this table just lays out the massive problem with that idea crystal clear. The key drug for both is rifampicin, but look at the difference. For leprosy, it's given once a month. For active TB, it has to be given every single day. A monthly dose would be completely useless for treating TB, and worse, it could create drug resistance. So you absolutely have to prioritize the tuberculosis protocol. That means statement D is a definite no. Okay, so after carefully taking apart all the false leads, we've backed the truth into a corner. There's only one correct statement left standing. And its importance? Well, it goes way beyond the clinic and right into the very heart of public health itself. And there you have it. That's our correct answer. And notice, it's not some complicated detail about a lab test or a tricky drug protocol. It's about a fundamental rule of public health surveillance. Both Hansen's disease and another one, American cutaneous leishmaniasis, have to be reported to the health authorities. It's the law. But what does compulsory notification actually mean in the real world? The best way to think about it is like a public health fire alarm. It's a legal requirement that forces doctors and nurses to report every single case they diagnose, and that one report immediately kicks a much larger system into gear. Yeah, that single, simple administrative step triggers this whole cascade of crucial actions. It lets the authorities track the disease, it guarantees the patient gets free treatment, and it starts the whole process of finding and checking anyone they've been in contact with. It's what gives us the data to plan for eliminating the disease altogether. It really protects not just the one patient, but the entire community. So now that we've officially cracked the case, let's zoom out a little bit. What exactly is this disease that was at the center of our whole investigation? So Hansen's disease is a chronic infection, and it's caused by a bacteria called Mycobacterium leprae. Now, while it does affect the skin, its real defining feature and the thing that causes the most severe problems is its unique ability to attack our peripheral nerves. And because of that nerve involvement, the diagnosis is what we call primarily clinical. A doctor is on the lookout for at least one of these three big signs. But the most classic sign, the one that really screams leprosy and not some other skin issue, is finding a patch of skin that has totally lost feeling.
no sensation to touch, heat, or pain.
You know, the fight against leprosy is really just one chapter in this much bigger scientific story. It all started back in 1873 when Gerhard Hansen first identified the bacteria causing it. Then you have giants like Nobel winner Robert Koch advancing the work, and that legacy continues right up to modern laureates like Tu Youyou, who champions the fight against these kinds of neglected diseases. So, after this whole deep dive, what are the big takeaways? What really matters here? Let's try to boil everything we've just uncovered down into a few essential points. These are really the core lessons from our investigation today. First and foremost, you have to report it. Second, remember the Mitsuda test is about immunity type, not an active infection. Third, the treatments for reactions are not interchangeable. Fourth, having TB at the same time completely changes the game plan. And maybe most importantly, catching this disease early is absolutely everything. And hey, for anyone who might need to remember this for a test or just to keep it straight in your head, here's a little trick. Just think the V in Vertelvian, that's the more severe form, stands for a void or a vacuum of immunity. That's why the Mitsuda test comes back negative. So we'll end on this final thought. We have a 100% effective cure for Hansen's disease, and in many places, it's given out for free. So the question is, why? Why, in this day and age, does a completely treatable infection continue to cause permanent physical disabilities and so much social stigma all over the world? The answer, it turns out, isn't just in medicine anymore. It's in public awareness, it's in early diagnosis, and it's in fighting prejudice. Thanks for joining me for this one.